Pertussis, commonly known as whooping cough, is a highly contagious respiratory disease caused by the bacterium Bordetella pertussis. It primarily affects the respiratory system, leading to severe coughing fits and can be especially dangerous for infants and young children. The purpose of this presentation is to provide an overview of pertussis, its impact on public health, and the role of nursing in its prevention, diagnosis, and management. We will also explore recent research, therapeutic approaches, and the significance of vaccination. Recent statistics on pertussis incidents within the last 5 years indicate a concerning increase in cases, with outbreaks occurring in various regions. The rise in pertussis cases underscores the importance of the understanding and managing of this disease. The causative agent of pertussis is the bacterium Bordetella pertussis. It spreads through respiratory droplets and attaches to the lining of the respiratory tract. This leads to inflammation and the characteristic symptoms of whooping cough. Understanding the epidemiology and etiology of pertussis is crucial in addressing its impact on public health. Pertussis, commonly known as whooping cough, presents with a range of signs and symptoms that progress through different stages. In the catarrhal stage, mild cold-like symptoms such as a runny nose, sneezing, low-grade fever, and a mild cough presents. This is normally 1 to 2 weeks after infection. In the paroxysmal stage, 2 to 6 weeks, severe uncontrollable coughing fits present, often with a distinctive whooping sound when trying to inhale between coughs. Vomiting or exhaustion can follow coughing fits. Coughing fits may occur more frequently during the night. In the convalescent stage, weeks to months after infection, you'll see a gradual improvement in symptoms. Coughing becomes less severe but can persist for several weeks. It's essential to recognize these stages, especially the paroxysmal stage, when its characteristic whooping cough sound, as prompt diagnosis and intervention are crucial for managing pertussis effectively and preventing further complications. Diagnosing pertussis typically involves a combination of clinical evaluation and laboratory tests. Recent advancements in diagnostic tools have improved accuracy and efficiency in confirming tests. Healthcare professionals access the patient's symptoms, medical history, and exposure to individuals with pertussis. The distinctive whooping cough during the proximal stage is a key clinical clue. A PCR test has become a standard method to detect Bordetella pertussis DNA in respiratory secretions, provides quick and accurate results. Serologic testing with measuring antibodies against pertussis can also aid in diagnosis. Recent advances in PCR technology have enhanced the sensitivity and specificity of pertussis diagnosis, allowing for more precise and timely identification of cases. This is vital for effective patient management and the prevention of further transmission. Pertussis can lead to various complications, and certain populations are at higher risk. Complications can include pneumonia, which is an infection of the lungs and is common and especially in infants. Ear infections can occur and can lead to hearing loss. Apnea in infants, where they may experience pauses in breathing, and even rib fractures from severe coughing fits. Infants are at most risk due to their immature immune systems. Pertussis can be life-threatening. In the elderly or vulnerable due to their waning immunities, and complications can be severe. Pregnant women need to get vaccination during pregnancy to protect both the mother and the fetus. And immunocompromised individuals are more susceptible to severe pertussis. Recognizing these complications in high-risk groups is essential for timely intervention and vaccination strategies, helping to protect those most vulnerable to pertussis-related complications. In the context of pertussis, the nursing process is a structured approach that guides nursing care. It consists of 5 key steps, often abbreviated as ADPI. The assessment step, you collect comprehensive patient data, including medical history and clinical symptoms, identify potential complications such as pneumonia or dehydration. In diagnosis, you follow the assessment nurses identify nursing diagnosis related to the patient's condition. For example, a nurse diagnosis could be ineffective airway clearance related to excessive coughing. In the planning stage, you base on the nursing diagnosis and create a comprehensive care plan outlining specific interventions and goals. For pertussis, this might involve measures to reduce coughing, prevent complications, and support the patient's overall well-being. In the implementation stage, you involve carrying out planned interventions such as administering medications, providing respiratory support, offering patient and family education, and ensuring comfort and safety. Evaluation is the final step. You assess the effectiveness of the care provided. Nurses monitor the patient's response to interventions, making adjustments as necessary. For pertussis, this may involve assessing improvements in symptoms and any complications. The nursing process is a systematic framework that ensures a holistic and patient-centered approach to managing pertussis, promoting optimal outcomes, and enhancing patient care. The assessment process for a pertussis patient is crucial for understanding the severity of the disease and planning appropriate care. It involves a combination of history taking and physical examination. You want a cough history. You want to inquire about the characteristics of the cough, such as its duration, frequency, and the presence of the distinctive whooping sound during inhalation. Any exposure history, ask about contact with individuals who have had pertussis or any confirmed cases in the community. Check the patient's vaccination history, as pertussis can occur even in vaccinated individuals. Assess other symptoms like fever, nasal congestion, vomiting, or cyanosis. In a physical examination, you want to evaluate the patient's breathing rate, effort, and lung sounds, as pertussis primarily affects the respiratory system. Observe for any paroxysms. Look for signs of severe, uncontrollable coughing fits, including the whooping sound or post-cough vomiting. Assess the patient's general appearance, including alertness, hydration signs, and any signs of distress. And measure oxygen saturation levels, as pertussis can lead to decreased oxygen levels during coughing fits. A comprehensive assessment helps nurses diagnose pertussis and understand the severity of the disease. It provides the basis for developing an appropriate care plan and initiating timely interventions to manage the patient's symptoms and prevent complications. Creating a nursing care plan based on assessment findings for a pertussis patient involves identifying relevant nursing diagnoses and outlining appropriate interventions. Good nursing diagnoses for pertussis patients would be ineffective airway clearance related to excessive coughing, which can lead to airway obstruction. A risk for aspiration due to vomiting during coughing fits. Impaired gas exchange related to decreased oxygen saturation during coughing. And anxiety due to distressing nature of coughing fits, or knowledge deficit regarding pertussis and its management, especially for patients and their family members. Create a care plan that outlines goals and specific interventions to address each nursing diagnosis. Goals should be specific, measurable, achievable, relevant, and time-bound. Intervention and nursing care strategies for pertussis patients aim to alleviate symptoms, prevent complications, and promote recovery. Here's a breakdown of key nursing interventions. For medication administration, you want to administer antibiotics such as azithromycin, erythromycin, or clarithromycin as prescribed. Antibiotics are most effective when given early in the catarrhal stage to reduce the severity and duration of the illness. Some patients may benefit from prescribed cough suppressants, but they should be used with caution, especially in infants, as they can interfere with clearing mucus from the airways. For respiratory support, you want to monitor oxygen saturation levels and provide supplemental oxygen as needed, especially during severe coughing fits, to ensure adequate oxygenation. Suctioning in severe cases may be necessary to clear mucus from the airways and improve breathing. You want to ensure adequate fluid intake to prevent dehydration, as vomiting and coughing fits can lead to fluid loss. Encourage small, frequent meals to prevent overeating, which can trigger coughing. Educate the patient and their family about pertussis, including the transmission, prevention, and vaccination. Instruct the patient on proper cough hygiene, emphasizing the importance of covering their mouth and nose when sneezing or coughing. Teach deep breathing and coughing techniques to help clear mucus from the airways. Provide guidance on monitoring and managing symptoms at home, including when to seek medical treatment. Implement appropriate isolation precautions to prevent the spread of pertussis, especially in healthcare settings and among high-risk individuals. Ensure healthcare personnel follow strict hand hygiene and respiratory hygiene practices. Offer emotional support and reassurance to alleviate anxiety, especially during coughing fits. Encourage communication between the patient and their family to address concerns and promote a sense of control. Nursing care for pertussis patients requires a multidisciplinary approach, including close collaboration with healthcare providers and the patient's family. Regular monitoring, prompt intervention, and patient education are essential components of nursing care to ensure the best possible outcomes and minimize the impact of the disease. The importance of monitoring patient outcomes and adjusting the care plan cannot be overstated. Pertussis can be unpredictable, and patients' conditions can change rapidly. Severe coughing fits can be life-threatening, so vigilant monitoring and flexible care planning are paramount to achieving the best outcomes and minimizing the impact of the disease. Regular assessment and evaluation allow healthcare providers, including nurses, to assess effectiveness. Monitoring helps determine whether interventions are working as expected and if the patient is improving, stabilizing, or worsening. Can prevent complications. Timely recognition of deteriorating symptoms can help prevent complications like pneumonia, which can be severe in pertussis. Optimize care. Adjustments to the care plan ensure that interventions remain relevant to the patient's evolving needs and stage of the disease. Enhance patient comfort. Customizing care based on ongoing assessment enhances patient comfort and quality of life during pertussis episode. Empathy, effective communication, and support are vital when caring for pertussis patients and their families because pertussis, with its distressing symptoms, can be emotionally taxing. Empathy and support help patients and families cope with fear and anxiety. Effective communication is essential for educating patients and family about the disease, its management and prevention, enabling them to make informed decisions. Empathy and support foster trust and cooperation, leading to better adherence to treatment plans and better compliance. Stigma can be associated with pertussis due to its contagious nature. Compassionate care minimizes social isolation and encourages individuals to seek prompt medical attention. Empathy and support enhance the overall quality of life for patients and families, making the healthcare experience more manageable and less daunting. Incorporating these elements into care can ease the physical and emotional burden of pertussis and help individuals navigate their journey toward recovery and prevention. Antibiotic treatment and early administration of macrolide antibiotics like azithromycin, clarithromycin, or erythromycin can help reduce the severity and duration of symptoms and prevent transmission of the disease, especially when given during the early stages of illness. Recent evidence highlights the importance of maintaining high vaccination coverage rates to create herd immunity, which indirectly protects those who are not vaccinated, including vulnerable populations such as infants who are too young to receive the vaccine. It's essential to follow the most recent guidelines from reputable health organizations such as the CDC or the WHO, as recommendations might evolve based on new research and epidemiological data. The significance of pertussis vaccination is evident in reducing pertussis incidence and its complications, particularly in infants and young children who are most at risk. It's a vital component of public health efforts to control and prevent the spread of the disease. In infants and young children, vaccination is crucial, with the primary set of pertussis vaccines starting in infancy, usually with the DTaP shot, and ensuring protection against pertussis in the most vulnerable age group. Booster doses, the Tdap, are recommended for adolescents, adults, and pregnant women to maintain immunity and prevent the transmission of pertussis to infants. Widespread vaccination in all age groups, including healthcare workers, helps protect those who cannot be vaccinated, such as infants too young for vaccination. This is called herd immunity. In the cocooning strategy, family members and close contacts of newborns are ensured up to date with their pertussis vaccination, thus reducing the risk of transmission to the infant. Pregnant women should receive the Tdap vaccination during pregnancy, during the 3rd trimester, to provide passive immunity to infants during the vulnerable early months of life.